Well, next we're navigating the complex landscape of TB in Latin America with a particular focus on Mexico. The lack of knowledge among medical students regarding the correct use of personal protective equipment, or PPE, is a major concern for our next guest. And this knowledge gap is not merely academic, it directly impacts the prevalent rates of latent TB infection among those who interact with patients in a medical setting. Now, to discuss these issues, I'm joined by Sofía Teresa Lozano Díaz, a medical doctor at the University of Monterrey. Lovely to have you here on the programme, Sofía. So what, first of all, the challenges about TB in Latin America, and specifically honing in on Mexico?
So there are many different challenges for Latin American countries, such as the lack of an early diagnosis through molecular tools and the early treatment, whether it's for latent tuberculosis infection or active tuberculosis infection. So in the case of Mexico, it's important to say that Mexico is the third country in Latin America with the highest prevalence of tuberculosis, just after Brazil and Peru.
Wow, I mean that's a high instance, isn't it? So Mexican doctors are obviously working incredibly hard. What are they doing to try and end TB?
So what we do in Mexico is that when we see a patient with the symptoms of active tuberculosis, what we do is that we do the sputum smear test, is the diagnosis that we do in Mexico. And after that, we use the regular treatment, the treatment of 6 months. And we also have in Mexico tuberculosis modules in many health clinics in Mexico, which they help us to treat patients with tuberculosis.
And in terms of those medical students, I'd imagine they play a pivotal role in caring for TB patients, don't they?
Yes, just as medical doctors and residents, medical students have a really important role, but they have also some struggles, just like one of them is that they have to bring their own personal protective equipment to the hospitals, because many public hospitals in Mexico don't bring medical students their PPE. So that's an important struggle for medical students. Another thing that we found in a recent research of 2021 is that only 21% of medical students in a university of the north of Mexico knew how to use personal protective equipment.
Wow, so I suppose in many ways they're a pivot point, aren't they? And as you as a professional with that overarching view of everything, what's your view on this?
So I think in Mexico there is a lack of education for personal protective equipment. Just to tell you a number, is that we have more than 400,000 infections related to the healthcare. And well, this just reflects the lack of education that we have in the use of PPE. And well, PPE, it involves a lot of things, just like wearing the correct mask in clinics, wearing gloves with certain patients, the regular hand washing, and it also involves the using sanitizer before and after being with a patient.
Many of the lessons that we learned for COVID, really, but
Yeah.
You're saying that's not being applied universally. They're not being applied universally across Mexico, but should be.
Yes.
Yeah, indeed. So let's look forward. How will you be moving forward working on TB and helping towards the end of TB, making sure that TB is a dim, distant history?
Yes. So one of the pillars for ending TB is research, because research, it helps to develop new tools, new ways for diagnosis, and it also helps for research investment, just to make accessible the diagnosis treatment for all people. And that's what I do. That I do research, and I also want to do with the union
work in collaboration with them?
Yes, to create new policies for medical students, because in Mexico, medical students don't have a screening test for latent tuberculosis infection. And we need those tests because, as I said before, there are a lot of medical students affected by latent tuberculosis infection.
Yep, and we need those medical students well,
yes,
don't we, in order to help care what they're set out to do. Fascinating stuff. Well, I wish you all the best going forward. Sofía Teresa Lozano Díaz, medical doctor at Monterrey University. Thank you so much for joining us here in the studio. Thank you.
Thank you so much.